Hi, my name is Dianelis. Today we are going to be talking about the Deming cycle and its application in nursing practice. Today I will walk you through the Plan, Do, Study, Act framework, commonly known as the PDSA cycle, and demonstrate it can be used as a powerful tool for continuous quality improvement in clinical setting. Initially formulated by Dr. W. Edwards Deming, the model has grown to be one of the most commonly adopted models of healthcare quality improvement. Let us get started. Quality improvement is not an administrative role alone, but an aspect of the nurse work. Nurses are also the best placed frontline caregivers to find lapses in care, identify safety hazards, and change things in a meaningful way. Structure change, however, it can be ineffectual or even injurious. That's why frameworks such as the Deming cycle are so useful. They provide a repeatable, systematic approach to testing and making improvement in a controlled fashion. Different organizations, including the Institute of Healthcare Improvement and the Young Commission, are recognized to advance the utilization of the PDSA cycles in healthcare environments and acknowledged to be effective in the enhancement of patient outcomes, error reduction, and overall quality of care. W. Edwards Deming was an American engineer and management theorist, and despite his fame in post-World War II Japan, where he assisted in the change of Japanese manufacturing into the model of quality and efficiency, the Deming Institute 2022, among his most significant convictions was the fact that most of the quality issues lie in the defective system and processes, but not in the weakness of individual employees. This approach is particularly applicable to nursing, whereby systemic problems such as poor communication, poor staffing, or bad protocol are frequently the underlying cause of incidents involving patient injuries. The PDSA cycle created by Deming was to assist groups in making small and testable modifications that produce information and learning and enhance the system in a progressive scale. The Deming cycle consists of four interconnected phases that form a continuous loop. The Deming Institute 2021. It starts with a plan to identify a problem, collect baseline data, and design an intervention by the team. The second is do. The plan is executed under a small measurable scale to minimize risk. The study stage is associated with analyzing the information that was gathered in implementation to conclude whether or not the change brought about improvement. Lastly, the act stage entails the standardization of the successful change into a larger practice setting or returning to a revision and a repeat of the planning. The advantage of this model is its interactive nature. It's not a one-time solution and is a constant cycle of learning and improvement. The lessons of every cycle are based on the lesson of the previous cycle. The phase of plan is the most critical phase since its enabling identified problem cannot result in effective solution. This step in nursing practice starts with a homework question. What are we aiming to improve whom and by how much? As an illustration, a nurse manager can observe on her unit that the number of catheters associated with urinary tract infections has been rising in the last quarter. In the plan stage, the team would examine the infection data, interview the personnel, observe the catheter in section, and maintain activities and apply the root cause analysis tools, including a fishbone diagram, to help uncover contributing factors. They would next establish a specific quantifiable target, such as calorie reduction by 20% within 90 days, and would designate team members to team roles in the process of making improvement. The do stage involves actual implementation of the planned intervention, but note that this is first conducted on a small level. The team does not deploy a new protocol throughout a whole hospital at once, but instead the team performed tests on a single unit or a single set of nurses. In our case, we counted the team may introduce a new catheter necessity checklist daily and a standardized catheter care package in just one medical surgical unit. The key points during this step are that personnel must be adequately trained, implementation should be well documented, and data gathering should be regular. Certain impediments and alterations in the core, which were expressed unexpectedly, will be known as well, and such findings will be useful in the study phase. The small-scale method minimizes patient risk and simplifies diagnosis of what it is and what requires alteration. The decision phase of the cycle is the act phase. According to the result of the study stage, there are three ways the team can choose. In case the intervention was effective, that is, the casualty rates were reduced accordingly to the planned intervention. The team proceeds to implement the catheter care band-aid at all units, revise the policy documentation, and train all nursing members. In case both results were not entirely satisfactory, maybe the checklist was effective, but the care band-aid protocol were not handled consistently. The team revised the plan and started another PDSA cycle with the changes. When the intervention failed to change anything or introduce additional issues, the team discarded the proposed approach, tried to learn what is wrong, and experiment with a total new solution. Importantly, documentation and sharing of knowledge must be a part of the act phase to ensure the whole organization is informed of whatever was learned. I would like to take you through a real-life scenario of the Deming cycle at work. Suppose a medical surgical unit has been seeing an acceptable number of medication administration errors. In the plan stage, the charge nurse goes through the statement of incident reports and learns that the majority of errors occur during the shift changes, where the nurses are interrupted a lot. The team developed a do not disturb policy with visual cues and a communication policy during a medication round. During the do phase, the protocol is piloted with a group of nurses over the course of 4 weeks on the night shift, where they undergo a specific training. In the study phase, the team will compare the rate of medication error before and after the pilot and will distribute a staff survey to evaluate usability. The finding indicates a decrease in the number of errors by a factor of 3 and a high level of staff satisfaction. During the act stage, the protocol becomes effective and the entire hospital. The policy is officially revised and the nurses who participated in the pilot project are acknowledged as having made a contribution. This is a straightforward but powerful example of PDSA in the real nursing practice. In conclusion, the Deming cycle is a simple yet profoundly effective framework for driving quality improvement in nursing practice. Having a systematic approach to the plan, do, study, and act model, nurses and healthcare teams can implement changes that are evidence-based and really lead to better patient outcomes, error reduction, and care delivery efficiency. The greatest contribution of this model is to the healthcare content is that it focuses on the small-scale testing and continuous learning and refinements. Teams can evolve as they acquire real-world information. As nurses, we're not passive recipients of policy. We are active agents of change. Each of us can recognize issues in the environment of our work and apply purposefully instruments such as the PDSA cycle today. Hopefully, this presentation has pointed out to you the Deming cycle as well as provide you with the confidence to implement it in your respective clinical setting. Thank you so much for your time and attention.